So first, to start with Matthew, can you just kind of tell me where you guys are at with the investigation in terms of identifying the source of this outbreak in Marshall County?
Yeah, happy to. And Sydney can feel free to jump into anything directed at me too, as long as that's okay with you, Alex. Where we're at in terms of the outbreak is both searching for the source and intervening to make sure all possibilities are addressed as we go. So we've zeroed in on cooling towers as the most likely source. Cooling towers are frequently a source of Legionella outbreaks, but they're not the only possibility. We interview each patient that we find with Legionella to assess all possibilities, and all evidence we have so far continues pointing toward cooling towers. We know that we might not be able to find which cooling tower, so we're making sure that every tower in the area that could be responsible has begun some thorough disinfection procedures as we continue looking to try to find the one.
Yeah, so I guess just to clarify, at this point, do you guys believe it's the source is multiple cooling towers in Marshall County, not just one?
It's more likely one cooling tower, but to say that definitively, we need a positive test. And we've not been able to find a positive test yet. It's more likely one cooling tower, but it's not impossible that it could be more than one. And that's why we're making sure that each one is addressed through these disinfection procedures as we find them.
So I guess now that you guys have identified, or at least said, more than likely it's these cooling towers in Marshall County, what's next in terms of testing? What does that look like?
So testing is a waiting game now. We've identified 12 different business centers with cooling towers in the area. We've got tests collected from each. Legionella is a really fragile bacteria. It's hard to grow in a lab, but we're relying on it growing to be able to determine which of those 12 business centers with cooling towers it could be. So right now, from a testing standpoint, it's a waiting game as far as testing cooling towers goes. Like I mentioned before, we're not waiting to act. We're making sure each facility is disinfecting now. The other side of testing is testing people. With each new case that clinicians in the area are identifying, we're trying to get a specific test on them, a sputum culture that we would be able to use to match from the person to the cooling tower if we're able to get a cooling tower to grow. So testing right now is a waiting game. Are we able to find Legionella that grows from one of the tests that we've already collected or not?
And I was going to say, can you explain a little bit more about what testing looks like? I imagine you guys are collecting water samples, is that right? And where do those samples get sent to?
Yep, that's exactly right. So testing looks different on a cooling tower than it looks on a person. We really only have one option for a cooling tower, and that's to test the water. We take a sample of that water, and Sydney is an expert on this. She's collected many of these samples already. We take that water from the cooling tower and we send it to the state hygienic lab in Iowa City, and they do our Legionella testing for us. After we collect that water sample and we send it to Iowa City, they'll put that water through a special filter that's supposed to try to find that bacteria. And then they'll put it on a growth plate on a culture where we watch to see Legionella growing, where we hope to find it so that we can be sure of which cooling tower it is. While testing water, it's really just this one process. There's a lot of options a clinician can use to test people. There's a very, very fast urine test that looks for a piece of Legionella. There's a culture on a sputum sample that's similar to what I described with water from a cooling tower. And there's a PCR test like uh, a nose swab that you can do to also look for Legionella. So a clinician has more options on a person than we have for testing water from a cooling tower. And the goal is to match those samples from what we get from a person with what we would collect from a cooling tower so that we can find the source of the outbreak.
And do you have any idea about when you should be getting those test results back from the samples from the cooling tower to say if there is Legionella bacteria in those towers?
Yeah, a Legionella culture can come back positive any day up to 14 days. That's when we would expect it to be positive if it's ever going to turn positive. And we're more than 14 days out for some of these cooling towers, and we're not finding Legionella so far. So any day now, we could find a positive culture. We haven't yet, and we're not going to hold our breath and wait for one either.
And have you narrowed the search down to a specific cooling tower or a certain region in Marshall County?
Yeah, all of the data that we have from calling patients, from seeing where they live and where they spend most of their time points to northern Marshalltown. So we've specifically honed in on cooling towers within northern Marshalltown. We have the most evidence that supports that area as the most likely source.
Yeah, it sounds like you guys are still trying to figure out, get that positive test to say without a doubt that it is one of these towers. But, have the cooling towers across Iowa or across Marshall County rather been treated at all? And should people who live in or visit Marshall County be concerned about getting Legionella?
So for the first question, yes, cooling towers should be following a water management plan at baseline. We know about risk of Legionella from cooling towers, and therefore it's best practice for any business out there with a cooling tower to ensure they have a water management plan and to make sure that they're following it throughout the year, anytime that cooling tower is turned on. There are disinfection procedures that help reduce the risk of Legionella building up, but it's hard to say that any disinfection procedure will eliminate that risk because each cooling tower is so different. We really recommend that businesses with cooling towers ensure they have a water management plan that has been fine-tuned to their specific cooling tower by a reputable vendor. That's a best practice. The second part of the question is risk in northern Marshalltown overall. We know that Legionella is in the environment and people bump into Legionella regularly. Legionella is found in ponds, it's found in rivers, it can be found in your garden, it's found in the soil. And Iowa normally sees 30 to 70 cases of Legionella per year. The vast majority of those aren't connected to one big outbreak like we're seeing now. It's sporadic cases that's an unlucky individual who might have been gardening or something like this. We're seeing a sizable outbreak now, which you can see when man-made devices like cooling towers or hot tubs or fountains have a buildup of Legionella. We know that Legionella is more likely to affect older individuals and people with chronic medical conditions, but it's most likely that most of us have already been exposed. I wouldn't say someone needs to change their plans to visit a business or a restaurant or needs to leave northern Marshalltown because of this outbreak. Most people are already exposed in their daily life, and it's unlucky few who end up getting sick.
Yeah, you kind of touched on this a little bit with your previous answer, but how are you guys working with businesses in Marshalltown to treat or disinfect the water towers?
Sydney, you can. I don't want to take all of the time on Alex's interview. If you want to chip in for any of these, maybe
Yeah,
I'll
that'd be
start.
great.
Um, so Sydney has owned a lot of this effort. So maybe I'll turn this one over to her. I'll just
Yeah,
briefly say
totally fine.
we've connected with each business, which is in the area where we think this could be coming from, and we've been in close to constant communication through phone and otherwise with those businesses about remediation. Remediation being to make sure that there's so much disinfection that we kill any Legionella that could be in that cooling tower. Go ahead, Sydney.
Yeah, so from the moment that we have tested each one of those cooling towers, we have recommended that remediation process before we've had any pet test results because we wanted to prevent the spread as soon as possible. So those, like Dr. Donahue said, we've been in constant contact with them, even updating plans just to make sure that they're maintaining that proper water management and getting the cooling towers maintained by not just their normal maintenance people, but with companies that specialize in this water treatment because they are very specialized machines. And it's just like, sometimes people can do you can change your own oil, but once it gets a little more intense than that, you want to make sure you have the right people to do the right job. So.
Yeah, I just had a few final questions for Sydney here, just a couple of them. From the cooling towers, how do you believe the disease has been spreading to people?
So Legionella is only spread through the ingestion of those contaminated water droplets, which is why we're focusing mainly on those cooling towers. Anybody who has spent time in the northern area of Marshalltown, you can ingest that contaminated water, whether it's, you're driving in your car, you're walking downtown, you're running into a restaurant to pick up food. We have a lot of areas, or you're just driving through to head to your next destination. It's very easily, like Dr. Donahue said, some unlucky few get it because of their underlying chronic medical conditions, while others just inhale it and it does nothing to them.
And that's really the risk is inhaling one of those water droplets that's hanging out in the air. It isn't from drinking the water or ingesting the water. It's really through inhalation of Legionella that's hanging out in a water droplet that's floating in the air.
Sure, that makes total sense. Um, and I guess, Sydney, what do you believe the scope of the outbreak is currently? Do you expect cases to continue to rise? I know we saw a few added just yesterday.
So we are at that incubation period, as Dr. Donahue said, that from 2 to 14 days is the time that we can see cases occur. Some of those, we have those testing happening and those remediation processes. So we're seeing increases, but that's to be expected because of that incubation period.
What would you say has kind of been the challenge to get the cases to stop rising?
Well, we're doing a great job both working with our local department, the local department being just myself, working with the state. Our people that we have tested these cooling towers with, they have been very responsive to get these remediation practices in their cooling towers and get them addressed as soon as possible. And if they have questions, reaching out to um, myself, the state, doing the proper things that they should to because they're concerned about the citizens of Marshalltown and those that are visiting for, anything, whether it be a sporting event, class reunions, anything in between.
And another tricky part is that it can take a lot of time from when someone is exposed to Legionella until when they get sick, until when they go see a doc and get a test. Like, it can take up to 14 days from when I'm exposed to Legionella until when I even start feeling sick. It might be another 5 days after that until I go see a doc, and then I get a test the day after that. So even after all the exposures are addressed, you can expect to still see cases for weeks after. So some of the nature of a Legionella outbreak is it can take time to start seeing them slow down, even when we have the right sources.
Yeah, one final question for you, Sydney. Excuse me. Just, what are you guys doing to ease concerns right now? I've seen a lot of posts on social media. It seems that people are really worried about this outbreak.
So I want to remind people that we're staying consistent with messaging. Look for, on the Marshall County Public Health Facebook page. Um, we are still actively investigating. While you may not see it on the outside, things are being done on the background, and we are doing these remediation processes, and we are working with these 12 businesses to do their remediation processes. So we may not have new information about what's coming out, and you will see, like Dr. Donahue, maybe those cases rise because it's going to take some time. But things are being done, whether people believe it or not.
Yeah, anything else you guys wanted to add real quick?
I
Either of
think
you?
I'll add one thing and then turn it over to you, Sydney. I think people should know that Sydney and her local health department, the state here, our entire team, the CDC, all of us are working together and we're working together night and day to figure out what's causing this outbreak and to make sure that it's stopped. I was personally on with CDC twice yesterday in the morning and then at night. I was on with Sydney multiple times throughout the day, and our teams have been in constant communication and we're taking this seriously and we're all working together. We're leaving no stone unturned as we try to hunt this down.
I would echo that and again say that Marshall County Public Health, unlike some of the other county health departments, is a one-person department. You are looking at Marshall County Public Health here, which is so critical to have our state and federal partners in this. And my favorite quote that I've heard since I've started is, when you've seen one health department, you've seen one health department. So, people just to stay with us and, follow the communication and stay up to date as we're trying to put it out, but also know that we're actively leading this investigation and we're getting to the bottom of it and working night and day, 7 days a week to figure out where this is coming from.